It seems like a lifetime ago, but it's just a year since Idaho's first confirmed case of COVID. CBS 2's Emery Moore joins us now live. She went to one of Idaho's top docs to talk about last year and our path forward.
Hey there, Brent. So I spoke with Dr. Peterman, who is also a pediatrician here at Primary Health. Now, I asked how the progress has been for the state of Idaho since the first case last March, and if he foresees us getting rid of masks now that there's a vaccine in play. Here's what he had to say. Do you know today that you wish you knew a year ago?
Every doctor would want to know at the beginning of coronavirus how devastating the disease is or has been, and that we needed to take very quick action in terms of all the mitigation efforts.
Will COVID-19 change medical care in the Treasure Valley for years to come?
First of all of us in terms of healthcare providers are going to do a better job of helping to decrease the spread of disease with our patients.
Mm-hmm.
Many of us will be using gloves and masks and certainly doing a better job washing our hands.
Do you think that we're going to have to wear masks going forward? And if so, how long do you think we're going to have to wear them for?
The goal is to get the positivity rate of the testing less than 5% or less, and the cases per 100,000 also in that range of 0 to 5. Those are the criteria to, in a sense, say that you've got control of a disease. I don't see that before the fall.
Besides having the amount of supply we need to vaccinate the state of Idaho, what do you think is stopping people, or what's the hardest part in your job to get people vaccinated?
This is part of so much of the misinformation with coronavirus. When I say we as healthcare providers, public health, and certainly politicians, and to a degree, scientists, we haven't done a good job of explaining to the public, whether it's here in Idaho or other states, how incredible these vaccines are and how safe they are. We have a lot of work to do to educate the public, parents, patients, adults. This is a safe vaccine, and you want to get it.
We discussed the toll of COVID has taken on medical staff. Now, how are they doing today, either in your building or other doctors that you know in the Treasure Valley?
It was the first month in 9 months that we didn't have any positive tests from our employees. We have 600 employees. If you want any evidence that vaccine works, oh my goodness, it's incredible.
Do you think that where we are today, did you think that we were going to be better or worse at this point if you looked at it back in March of last year?
I had no idea in March of last year that we would have gone through what we just went through, that 500,000 people in the United States would die. I never could have imagined that. I never could have imagined that our whole community was shut down. No schools, no restaurants, everyone out of their places of work. I mean, that's just unbelievable. I guess I'm not surprised that we still need masks because as we heard more about vaccine, it was pretty obvious to myself and the rest of us in healthcare that we just don't have enough vaccine. And the second challenge with the vaccine, even if we have enough vaccine or we're beginning to get enough in our community, you got to get them in arms. You got to get people vaccinated. And it's a process. It's a process.
Dr. Peterman is hopeful that once more people get vaccinated, we can go back to the things we love, like traveling. I know I miss traveling a lot, and even visiting with our elders. Live in Boise, Emery Moore, CBS 2 News.